Yo, yo, yo. Hey guys, welcome back to another amazing edition of the Best Practices Show. In this episode, it's a powerful one in which Dr. Christian Coachman is returning from his event in Miami with Dr. Michael Appa. It was called Designing Smiles. There were hundreds of dentists that attended, and they debated how they see great dentistry. They didn't always agree. And in this episode, Christian shares 14 insights, whether they agreed or disagreed on these important concepts. Please listen up. I hope you guys enjoy this, and we'll see you soon.
And 3, 2, 1, and we are live with Coffee Break with Coachman, together with my friend Kirk Behrendt. Kirk is going to be on the background, making sure I'm on track and not forgetting the questions. And today we have an amazing topic, fresh topic. We're going to talk about the recent course, Designing Smiles, with Michael Appa and Christian Coachman.
Hey guys, welcome back to the Best Practices Show podcast. You know the jam around here. I get some of the world's best thinkers, teachers, speakers anywhere, and our job is to bring them to the podcast and share some insights so that you can create a better practice, a better life. In our ongoing series with Dr. Christian Coachman, he just came back from a transformational experience down in Miami with Dr. Michael Appa, and I'm going to have him describe that whole thing and some key pieces of learning that happened. Christian, thank you for coming back, brother. I appreciate you.
Great pleasure to be back and to restart our series here of podcasts. Always a pleasure. And yes, I just landed from the airport straight to the studio to connect with you. And of course, everything is fresh in my mind about everything that happened this weekend. One of the most intense weekends in my professional life, on my lecturing life. This event that we organized in Miami, that we've been planning for actually many, many years. We've been thinking about doing this and then pragmatically working in this event for more than a year. And it happened, and it was a big success, and we are very happy and relieved, and the feedback has been amazing, and maybe we are even going to do it again. Let's see. But yeah, we, for the ones that don't know what happened, me, Christian Coachman, and Michael Appa, probably one of the most successful dentists that I know in the world. Mike Appa, that developed his brand in aesthetic dentistry and became a huge brand himself with Appa Aesthetics. His traditional practice in Manhattan, but then opening in Dubai, becoming huge in Dubai, flying back and forth himself to Dubai, every other week for many, many years. Then he opened in LA and now has a very successful practice in Beverly Hills as well. And this week, in the week of this event, he opened his new practice in Miami. Unbelievable architecture, beautiful practice. All the practices look amazing. And Mike is known for, very well known for a couple of things, among the dental community. First, for having this amazing, successful business and brand. For transforming smiles of so many celebrities. He's really a celebrity dentist. Huge following on Instagram, almost 600,000 followers on Instagram. Mentors many people, many people looking after him, wanting to be him or wanting to learn from him. He has an amazing system with his in-house lab. He has an in-house lab with more than 30 technicians or more than 40 technicians just for himself in his 4 locations. Some of the best technicians in the world. I'm actually helped him recruit some of them, many from Brazil. Amazing ceramists working full time for him in all the locations. So he has an amazing system to deliver beautiful smiles. And of course, that's why he's so successful. Now, uh, since ever, we've been trying to put something together. First in the early 2000s, in 2004, when I first met him, we almost actually worked together. Larry Rosenthal, his mentor, um, hired him to work in his practice and was about to hire me to work on his practice, to work as a technician. So in 2004, we almost worked together for Larry. Of course, then Appa took over Larry's practice and grew from there. But we kept the relationship, and every other year we would meet and try to find a way to collaborate. Sometimes talking about opening practices together, other times talking about opening a lab together, other times talking about doing some special cases together, other times talking about starting an educational program together. But you know how life is, super busy. 5 years, 10 years, 15 years had gone by until last year when I said, Mike, I have an idea. We're going to put a course together. And the reason this time is going to happen is because this course is going to be all about what really unites us, what really unites me, Christian Coachman, creator of Digital Smile Design and founder of DSD, and you, creator of your systems, founder of Appa Aesthetics, and a dentist that is transforming smiles for so many. The topic will be exclusively and purely 100% focused on smile design, not anything else. How do you brand yourself as a smile designer? How do you grow as a smile designer? How do you become a better smile designer? How do you communicate as a smile designer? How do you implement systems to master smile design? How do you interact with the lab, specifically about smile design? How do you diagnose smile design? How do you treatment plan smile design? How do you execute smile design? And he loved the idea because that's what he does every day. That's what I do. And we have completely different perspectives. He's very analog. I'm very digital. Whatever he's doing is working perfect for him. Whatever I'm doing is working very well for me as well. He has an in-house lab. I own an outsourcing lab. Um, I help dentists from all over the world to design their own smiles. He designs himself for his patients. But as we like to say, even though we use completely different tools, completely different systems, our vision about dentistry is very different. When it comes to smile design, we have exactly the same starting point, and we have exactly the same final goal, right? So with the same starting point and the same final goal, let's go to a course and live on stage, let's debate. Let's debate our differences. Let's debate our systems and our philosophies. And let's create a course where we are completely free to interact. It's not like you give your lecture, I give my lecture, but we're going to be teasing each other on stage.
Mm-hmm.
We're going to be picking on each other on stage. We're going to be commenting. We're going to be criticizing. We're going to be making fun of each other on stage. We're going to do whatever we want, but with the main intention to get to some common ground, common sense, what really matters at the end, right? So with that in mind, I started to put the program together, and we met several times. We worked on each slide. Imagine 2 days. We had we had from 8:30 to 6:30, almost nonstop, right? 2 days, so almost 20 hours of content. Super dense, super intense. And the course came out. It actually happened this weekend. So, um, and what we imagined actually happened. It was a big debate, a lot of fun on stage, some tense moments, even some moments of high intensity, of not really agreeing sometimes with each other, but in a very cool way. Um, the audience really loved it, mainly the back and forth. And my suggestion here today is that yesterday, when I was flying back home, I said, okay, let me take advantage of the fact that everything is fresh and let me write down everything that he said that I don't agree, and everything that I said that he doesn't agree. And let me also write down everything that we both said that we do agree on the main topics of the course. And as we were talking before start recording this, there are 14 main moments basically that we covered, 14 main conclusions, 14 consensus, let's say, that I want to quickly summarize here with you.
Let's do it. And one thing I mean, there were several hundred dentists that witnessed this, right? Like you had a packed house.
We had a packed out. That was also very cool. As you know, we are all about the experience, and APA is also focused on the experience. So the course needed to be an experience.
Right.
First is that it was an amphitheater. It wasn't in a hotel room, so it had the amphitheater style. It was a theater for concerts, right? We had probably one of the biggest LED screens you can imagine on stage. Amazing AV team, 3 tons of AV equipment, amazing visuals, amazing layout, amazing ambience, great music, of course, always. Great doctors. We had 500 people attending. It was sold out super fast. So it was a big success to start with, what put a lot of pressure on me to actually put the program together and deliver. I was really worried. We didn't have time to rehearse much, so I knew that things would just happen live on stage. And the team on the backstage did an amazing job, and everything went really smooth. We had several laptops and iPads. We had live demo. We had a live patient. I did a live wax up on stage. He did a live mock up on stage. We did clinical discussions of case discussions live through iPads. We were drawing over cases. The audience was sharing cases with us, and we were discussing the cases. So there was a lot going on, and
Yeah.
it came out nice. Of course, I already have a million things that I want to do better for the next time, but I think it was a success.
Yeah. So if you're looking at social media, there's a lot of people there. It was pretty exciting. So let's go through each one of these. And, and the first one was the documentation philosophy and smile rehabilitation. Walk us through that.
So let me just quickly read my note here, and then I will be able to comment here. This is what I wrote. When it comes to documentation for smile rehabilitation cases, APA and me, we agreed on the need of a high quality and complete initial documentation with emphasis on the face. So this is something that unites us. He has his own way of capturing the face. We have our own, but we both know that this is the starting point. You need to document the face very well. And while it does sound obvious, as a lab owner, I can tell you, labs all over the world are still not getting quality facial information with their cases. So doctors are still not exploring fully, ideally, a systematic approach on how to document the face and how to share this information with the lab. So this was a very strong outcome and common sense we need. Every doctor there needs to incorporate on your first appointment how you're going to look at the face, how you're going to diagnose the face, how you're going to document the face, and how you're going to communicate the face, right?
Yeah.
So this was a first point.
Yeah. Point number 2 was diagnosis and planning.
We're still on the face, you know.
Still on the
there
face.
was
right.
yeah, it's still on the face. There was kind of a different approach here. I believe that a simple protocol with intraoral scanner and a smartphone is enough.
Yeah.
So if you have a smartphone and you have a scanner, you can capture the face, you can capture the mouth, very simple on the first appointment, and then send to the lab. APA, he still does more sophisticated DSLR camera photo protocol, what is beautiful. It's more time consuming. I honestly don't think is necessary the extra work, but he still believes that the sophisticated pictures still bring an added value. So this was a conclusion. I emphasized the importance of the video, and this is something that he totally agreed. He actually mentioned that he learned from me, and he started 7 years ago, making it mandatory, and for DSD is mandatory, facial video analysis. So documenting the patient's face through video, and then training yourself and your team on how to interpret the video, analyze the video, the motion, the movements, dental facial harmony or disharmony through motion, right? So this was a common sense. 12 o'clock picture, also a common sense. 12 o'clock angle analysis is mandatory in the DSD protocol, and APA showed live on stage how he analyzes the smile from the 12 o'clock position. So the 12 o'clock position analysis and documentation was also common sense there. That's topic number 1.
Love it. Love it. Love it. And if you're listening to podcasts, it would be awesome to just dive deep into the mechanics and the why, but we can't do that today. Maybe we'll come back and do that as a follow-up. But point number 2 was diagnosis and planning. And I do love this. I love how you're able to separate those points of view for the benefit of everybody else listening. This is great.
Yep. Actually, I of course, this was the consequence of me thinking for a few hours and writing this down. People at the course didn't get the benefit of this summary. This is going to be probably something that I'm going to share with them afterwards, maybe during this week. But of course, on the next course that I was able to convince Mike, we're going to have a next course. And many people that did this course sending us messages that they want to do the same course again.
Yeah.
So there will be a next course. And of course, that this summary here will make the next course even better, because we're going to start from this and we're going to emphasize in each block the conclusions with even better understanding of this conclusion, right?
Love it.
So point number 2, you mentioned diagnosis and planning. What are the differences and the similarities? So I explain my belief in exploring collective intelligence, asynchronous communication, and digital tools to understand all issues and develop a diagnostic design and build a treatment plan to be presented on a second appointment. So for me, it's very clear that whatever conclusion you share with your patient on the first appointment, you're missing the opportunity to further explore collective intelligence and digital analysis to understand better the problems and explain to the patient on a second appointment. Now, APA explains the challenges of postponing this communication to a second appointment, because many patients will not even show on the second appointment, and you're going to miss the opportunity to close the deal. APA is all about quick analysis, quick diagnosis by himself, completely alone. So no interdisciplinary discussion, no comprehensive discussion. Everything is in his head. He looks at the patient. He doesn't leverage 3D technology to diagnose and plan. He relies 100% on his clinical experience and x-rays, of course, and pictures, x-rays, and clinical experience. And in a few minutes, he gets the conclusion and he already immediately presents to the patient. Now, of course, you can understand the advantages of having this huge impact immediately. I still believe that this may be good. His approach may be good for business in this first moment. But when it comes to comprehensive care, I think the future belongs to the dentist that will be able to convince the patient about the value of not rushing into conclusions at that point and scheduling the second appointment to leverage collective intelligence and 3D diagnosis, 3D simulations, and so on. So APA does a same appointment clinical examination, assessment, x-rays, and photos, and believes that this is enough to define the plan and present the plan on the same first appointment. Okay. That was, I think, a great discussion moment there, because I do appreciate his approach and it works for him. I still believe that it's impossible. It doesn't matter how good he is and how much knowledge he has in his mind. Thinking with several brains will always bring benefit. But the challenge, we both agree, the challenge is how to make the patient value that. So that's why DSD works so hard on helping dentists to try to create value towards the patient so the patient values this process. But I do agree that sometimes when you see that the patient is not getting it, you may need to give something on that first moment and get the patient on board. So again, understanding all options and using the best strategy for each situation. Another point. Christian believes in comprehensive care with strong involvement of perio and ortho to diagnose and plan all cases. Separating the day of data collection and treatment presentation by a few days to appointment process will allow you to integrate all the specialties. APA believes he can solve almost all cases only with restorative and prefers to diagnose and plan alone without collective intelligence, neither 3D technology. He believes that if plan is not presented on the first appointment, case acceptance chances will drop drastically. I do agree with that. Christian agrees with that, but still believes a two-appointment approval is key to develop ideal comprehensive care and can be financially successful if you master storytelling. It is more difficult, but it's possible.
Mm-hmm.
So that was the conclusion. That's topic number 2.
Yes. Now, topic number 3, approaches in comprehensive dentistry.
No, case acceptance.
Case acceptance. I'm sorry. Case acceptance and treatment presentation.
Actually, comprehensive, we already discussed, he believes that comprehensive is all in his head. I believe that comprehensive is a combination with several heads. Basically, that's it. On case acceptance, performing the motivational mock-up and presenting the plan to the patient. APA and Christian both believe on the importance of this moment and both created their own powerful workflows to be successful with case acceptance. DSD is known for the case acceptance emotional dentistry approach. And APA is also, of course, known for case acceptance as well, since his numbers are insane. Like, there's absolutely nobody in this world that does more smile design cases per month than Mike APA. I can guarantee you that. Mm-hmm. In 4 different locations, his numbers are insane. So, learning from him how to generate the leads, how to convert the leads, and then how to deliver quality to stay in the business for 20 years. It's something that, regardless if you agree with the way he approaches treatment planning and dental execution, you have to admire his systems for case conversion and clinical execution with high quality and beautiful outcomes. So that's something that I always admired, regardless if we agree on interdisciplinary approach, yes or no, right? So um, both believe on setting up the treatment presentation room where you can leverage storytelling and visuals. So this is something that if you go to his practices, you're going to see a complete, everything happens around that consultation. He calls the consultation. The consultation is this first appointment, right? I call the first appointment emotional dentistry approach. He calls the first consultation, right? And technology, the team, we both believe that everything, it's like we say the Cirque du Soleil, it's a show. It's showtime, right? That first appointment, everything needs to be rehearsed, smooth, perfect, impactful, meaningful, straight to the point, and the patient needs to say wow at least 3 times, right? In that 1 hour. So we both believe on spending time building the infrastructure and the mindset to leverage storytelling and visuals and create this amazing experience in the practice at the beginning. We both believe that you never have a second chance to create a first impression, and the business moves around that. We both believe that there is not one fits all strategy. You need to master all strategies and customize depending on patient's character, case, and time. Okay, so you need to be a master to read people emotionally. Another thing that Appa does very well with his team is that he has a process between the person on the phone on his team, the first call, the treatment coordinator, data collection. When he meets the patient on the first time, he already has a whole x-ray and a background of the patient that allows him to come in and already know exactly who is in front of them before he even meets the person. So he has a very effective system for that, and he explained in the course, and I agree this is huge, right? To really exceed expectations at this initial moment. Appa explores the direct mock-up, even though he mentioned he is doing it less now. Direct mock-up means that somebody that you never met sits down in front of you, and after the initial conversation, you look at the patient and immediately you understand what is right and what is wrong. And in a few minutes, you build a new smile freehand with composite, right? In 10 minutes. He's very well known for that, and he's very good at it. But of course, it requires a lot of energy, a lot of time, some chairside time. It's not for every case. So he's now blending it more with having the lab do wax ups and him placing the wax up in the mouth instead of him building from scratch. Or leveraging, in my case, my suggestion, leveraging smile simulations with software. Both of us showed how do we do drawings, freehand drawings, chairside on the iPad, mirrored in a big TV in front of the patient. So taking pictures, putting the smile and the face on the screen and starting to draw on top of it live, 100% improvised, and showing the patient that we know what we are doing, right? We immediately know what is right, we know what is wrong, we know how to improve it, and we can translate our vision through drawings. The key, again, is that you need to have a smile design tool. You need to be able to express this project to the patient. So use visuals. If it's pictures, direct mockup, indirect mockup, software, iPad drawings, you need to master all of them and choose the tool depending on the occasion, the case, and the patient, right? Um, I believe on saving time by leveraging the lab to do the design. But both agreed that regardless of how you do the initial diagnostic design or the initial smile design or the initial prototype design or the initial mock-up design or the initial trial smile design, whatever you want to call, the huge differential comes from dentists that knows how to try these projects in the mouth, analyze it, modify them until they are ideal. So Appa was emphasizing you need to be the one doing it. And I was commenting, you don't actually need to be doing it, but you need to master the process of improving it, right? If a lab can do a wax up faster, better, cheaper than you, let the lab wax it up digitally or analogically. Put it in the mouth. But one thing that we both agreed, it doesn't matter how amazing the software is. It doesn't matter how amazing the technician is. It doesn't matter if you're amazing with wax ups, 3D technology. It doesn't matter. 2D, 3D in the lab, it's never like in the mouth. The mouth will give you the reality of how good or how bad or the smile is, right? The fact that you are in 3 dimensions in the mouth, the fact that you have the motion, the fact that you have the soft tissues, the facial tissues on top of it, the patient's character. So you can do the perfect design in the lab, you put it in the mouth, and you still have to touch up in the mouth. That is the key. Meaning that if you really want to become a smile designer, like Appa and myself, you need to be able to take whatever was done outside the mouth, put it in the mouth, and tweak it, and fine tune it, and improve it, and change it, and shape it with your own hands. You have to do it. There's no system today that allows you to bring the face into the software with the soft tissues, with the motion, with the delicateness. If you add 1 millimeter buccally, you're going to add a little extra pressure on the lip. And a little extra pressure on the lip will change a little bit the mobility. That will change a little bit the way the smile looks from a certain angle that can only be seen in real life. So that was a huge take-home message. My technician is amazing. He does the smile design for me. That's fine. You will get to 90% of the quality, but you're not going to hit 100% of the quality. Because unless you hire a technician to come in your practice and your technician will do everything inside the mouth to finish inside the mouth. But then your technician will take over all the credits as well. And your patient will be grateful. When it comes to the smile design, the patient will realize that the magician was the technician and not the dentist. So if you want to be the magician changing lives, you need to master the process in the mouth, regardless of the technology. Does that make sense?
Makes perfect sense. Number 7. Are we on number 7?
So Christian believes there are 2 very different markups. One is the motivational done before case acceptance with the main intention of getting the patient on board, selling the case. And the second one is the technical markup done after case acceptance to technically communicate with the patient, lab, and guide the prep. So in the DSD workflow, we have very clear 2 different smile test drive moments. One before case acceptance with the goal of creating the wow effect, and one after to create the rational discussion about smile design. So you need to master both moments and how you communicate with the patient in both moments. Appa has a different approach since patients come to him already wanting to do an elective smile makeover. So the fact that patients are going to him already, I want to do it. I want to do it with you. I just need to find a push. I just want to understand. So his first mock-up is a mix between motivation and already technical discussion. So this is very important for people to identify their situation with their patient, right? Is this a patient that has no clue how smile can change their life and you want to motivate them? They're going to accept the treatment after. Is this a patient that is already on board and now you want to rationally get them on board of the design? So you need to think when you're doing a smile test drive, in what moment is your patient, right? because the strategies are completely different. Um, Both Appa and Christian showed similar tricks for markups and with black markers and optical illusion and composite, because most of the times the motivational markup is happening before you started the treatment. So it needs to be additive. And in many cases, ideally, it's not additive. So you need to cut back to do the markup, right? So you need to find ways. If you're going to do a motivational markup on a subtractive case, you need to use tricks to overlap what exists and make it look good. That's why after you reduce the teeth, either through burrs or ortho, you're going to have the second markup that is the ideal markup. And that's something that both of us do. When things are in position, before prepping teeth, we always do the second technical markup to guide the preps and also to finalize the communication with the patient. This is what we're going to get. Both agreed that markups are not possible in some drastically subtractive cases. So motivational markups are not possible in some certain situations. On these cases, you need to rely on other strategies to communicate and motivate patients. Christian mentioned that the digital smile simulation can help in these situations, and APA believes that the key is to create a level of trust that the patient will feel comfortable accepting it without visualization. So this is when I did the demonstration of the DSD app, how you can make simulations on cases that you don't want to do markup or you cannot do the markup. And APA is much more on creating a relationship immediately with the patient where you better trust me, you're going to trust me. And the whole experience is like the patient like, okay, I trust you, let's go for it. Next, both agree that 2D or 3D softwares and even handmade work on analog models will never provide the full perspective of dental facial integration. Actually, we already talked about that, right? Mm-hmm. So no outside the mouth tool will generate the full perspective of dental facial integration. The only way to have a complete perspective of it is in the mouth. So anything that is done digitally or in the lab or in models or outside the mouth needs to be validated and improved by the dentist in the mouth. That was a big message. Mm-hmm. That's the reason why this course was so important. That was the goal of this course, to give the insights for dentists to become the real quarterback of this process, right?
Yeah. Love it. Love it. Did you have a moderator at all that could say, okay, if it ever got heated or a little bit? No, you guys.
We didn't.
You self-moderated?
We could. Yeah. I was kind of doing that role, but that may be an idea we can explore for the next course, to have a moderator.
I'm just telling you, I want to go next year. And it might be a good idea to throw questions in. And
you are my guest, 100%. And you could be an amazing moderator.
Well, I think you need somebody that knows something. So, but I'm so happy to ask the questions that somebody else would want to ask. But keep going, my friend.
Yeah. So both agree that branding, that's a big one. Both agree that branding happens chair side above any other type of marketing. This is a quote from Mike. Mike always says that because he gets really angry when people say, Appa, you're very successful because you're very good with marketing. He gets pissed, right? So I'm very successful because I'm very good chair side, because I'm delivering quality in the mouth. That's why I'm successful. Everything is a consequence, social media, marketing, they can help you, but magic doesn't happen if the magic is not chair side. So, and we both agree that the whole DSD purchase moment experience, we talked about that in the past, the the magic is not on the marketing before, neither on the clinical execution after, but is on those first and second appointment moments where you're creating the experience chairside or in the presentation room, right? So I think that was a big point where every dentist needs to ask themselves. One thing is to master clinical work chairside. One thing is to master everything, the whole experience chairside, right? And differentiate yourself. A great clinician is one thing, but a great clinician that knows how to create a great branding experience chairside is different. So you need to think about that. Otherwise, you're going to just be a great clinician, right? And the patient, unfortunately, is judging much more the rest because they're not seeing the clinical execution, at least on a short period of time. So rehearsing with your team, like Cirque du Soleil, how the chairside experience happens in a way that everything is so smooth that the patient is impressed, regardless if the patient can identify the clinical quality of what you just did, right? So that is, for me, very, very important. Both agree that the first appointment experience needs to be so good, so rehearsed, so smooth, so precise and effective that this will be the number one reason for somebody to choose you as their dentist. You never have a second chance to create the first impression, and that first impression on that first 1 hour with you in the presentation room and in the chair is the key for success. That's what is going to give you leverage and credits with the patient, that even if something goes wrong on the treatment, you still have the credit, and the credit comes from the first impression. Patient experience is key for both. So me and Appa, of course, we focus on patient experience. I like something that Appa said in the course. He develops systems for patient success. Everybody talks about practice success, clinical success. And he is like, my systems are for patient success. And it's a very subtle difference, but huge at the same time.
Right.
The success needs to be the success of the patient. The patient needs to go home after each appointment feeling like this was success for me, right?
Right.
So many things in dentistry, we know that long-term is hopefully success for the patient, but at that moment after that appointment, the patient is not feeling very successful, right? How do you turn this upside down? How do you create situations where everything you're doing is generating the sensation on the patient that this is success for me? So he says, Appa mentioned about the strategies for patient success, understanding what they want and focusing on fixing their problem for them. Meaning, every good dentist is always fixing problems for the patient. But many times we interpret wrongly what they believe is their problem or their priorities or what really matters for them. What is success short-term, mid-term, and long-term for them? And that made me evaluate Appa's work slightly different because I was many times critical to him, and we are always very honest to each other. Say, Mike, why you didn't consider this treatment? Why you didn't consider that? Why did you prep this way? Why didn't you do ortho? Why? And of course, I still have many situations where I don't agree with his treatment plan. But today I understand better that many times he is doing what is success for the patient. And patients are grateful, and patients are coming back after 10, 20 years. And if he was just driven by money and aggressive dentistry, he wouldn't be as successful for so many years. It's impossible. So he is doing uh, something right for the patients that are making patients come back over and over again. And this is something that we need to be open to listen, right? APA strongly avoids ortho. CC strongly encourages people to explore ortho possibilities and advantages, but does agree with APA that too many times ortho can create more problems than solutions. So this is my point here. Because I'm all about interdisciplinary, always considering ortho, etc., philosophically beautiful, but real life is different. And many times when you try to do ideal and things are not perfectly under control, or the specialists are not really on board, or you're not working with the right tools, you take what you learn from courses from the interdisciplinary perspective and you bring to real world, and you end up transforming the patient's life into a nightmare and not getting the problem solved. So having a certain level of pragmatism and an honest acceptance that it's much easier to say that interdisciplinary is better than to actually do it for real and make it better for the patient's life, right?
Mm-hmm.
So doing that beautiful digital design on the software with ortho simulation and showing that beautiful lecture about integrated approach and etc., and then going into real life and having the patient go through 1-2 years of ortho, ending up not on the right place, one more year of ortho, and then changing orthodontist, then one more year of ortho, and then ending with an open bite and TMJ issue. This is too common. And that's the criticism that Apat has with this comprehensive philosophical approach. He's like, with a little bit more aggressive preps, I can get this done in 2 appointments and have a new smile working for the patient for 20 years. So it's not a very clear line between being pragmatic, being minimally invasive, short-term benefits, long-term benefits, but I definitely respect where he's coming from. Of course, I still believe that we should be pushing more and more for conservative and interdisciplinary approach. And if the specialists are not doing, if a case is not done properly, we need, instead of quitting, we need to understand how to do it properly, right? So this was the debate, but it was, I think, people really got that there's no black and white, there's no right or wrong. It was a very nice discussion into um, exploring the possibilities from my perspective, but also keeping the patient in mind and giving a pragmatic solution for the patient from his perspective. Next topic. CC, me, Christian Coachman, strongly believes that artistic, yeah, that's me.
Yeah.
I believe that artistic skills and intuition is the key to diagnose bad smiles and design beautiful smiles above any rule, above any scientific article or guidelines. This is something we made it very clear. I spent a lot of time sharing parameters and guidelines and articles and rules and principles, but at the end of the day, being a great smile designer is very subjective and artistic. You can read and memorize all the articles in the world, and if you don't have artistic perception, you will never be a good smile designer.
Right.
So at the end of the day, all the articles are interesting for you to understand what is out there, understand what is the norm, what is the average, what are the guardrails, right? And the parameters. But this is just a starting point for me. APA was much more not using any guidelines and just looking and having everything in his brain. What works for him, because he's very good with his own eyes and his eye-hand coordination very good. My point is that every time you study the rules, it gives you much more skills to break the rules and improvise and adapt and go beyond the rules, right? So that's why I still love to read the parameters, share the guidelines, and give some starting points. So the incisal edge should be 2 to 4 millimeters longer than the lip at rest. Okay, that's a starting point. What do you do with that? At the end of the day, this rule will not help you solve the problem, because when you talk about 2 to 4, it can actually be from 1 to 5. That's the whole world. You look at the patient and you say, okay, the article is saying that the incisal edge should be exposed 1 to 5. What do I do for my patient right in front of me? It's on you. You need to look with artistic perception, subjective perception, and artistically define that because of who you are, because of the face that you have, because of the dynamics and the motion of your face, because of the smile that you dreamed with, this is where the incisal edge should be. So the articles will not help you with that final stretch, right? So Appa was like, don't waste time with rules and parameters. And I was, know them, use them as a starting point, but at the end of the day, Appa and myself, we are using and doing the same thing: intuition and artistic skills. Understanding the norms, guidelines, and parameters is key as a starting point for communication purpose. I also defended the fact that knowing the norms, knowing the parameters, will also help you become a better storyteller to communicate with the patient. Because one thing is to tell the patient, look, your incisal edge should be here. Why? Trust me, I'm an artist. The other thing is to say, look, your incisal edge should be here. There are certain parameters that we followed. Articles show that from 2 to 4, you are inside the norm. When lip dynamics is below 9 millimeters, blah, blah, blah. So you protect your decision with some science, with some parameters. It usually helps with the patient, right? The patient sees that there's a combination between art and science to define and to protect that decision. So starting point for communication purpose to generate authority and give borders to the intuition and art. That's how I use parameters in smile design. I'm talking specifically about smile design, right? Specifically about smile design. Because people love to publish a lot of articles about smile design, about parameters. Don't overvalue them. I agree with Appa on that. Don't overvalue them. They're just there to give you some insights. It's on your artistic skills. Appa believes that Christian spends too much time with guidelines and rules. Christian believes that drawing guidelines is a great way to help your brain and eyes to see better and activate your artistic skills. So that was a cool discussion. The more experienced you become, the more these lines will be embedded in your brain. Naturally. That's why Appa says don't waste too much time with guidelines and parameters, mainly because he doesn't even notice that they are already inside his brain, right? Because he does that so much and he's so good at it, it's already there. But you need to go through the process to get it in there, in your brain. For Christian, exercising drawings is a great way to activate your artistic brain. I always say that every dentist should, whenever you have time, just draw, free drawing. If you're sitting down having a coffee, take a piece of paper, look at something, look at an object, try to draw it. Try to draw a tooth with shadow, light and shadow, contours, perspective. Drawing is the starting point of an artist. You cannot sculpt teeth in 3D if you don't know how to draw. Dentists, they skip and they try to do things with their hands without even controlling the two-dimensional process of creativity and drawings. So for me, that is, if I needed to do a smile makeover myself in my mouth, and I was trying to find a dentist, I would do that test with dentist. I would say, dentist, please draw a smile right here in front of me in this piece of paper. If you cannot draw a smile on a piece of paper after 20 years doing cosmetic dentistry and saying that you're an expert in aesthetic dentistry, you cannot draw a beautiful smile in a piece of paper, there's no way you're going to touch my mouth. No way. Because you will not be in charge, you will not be in command, you will not be able to work with your hands, because everything beyond drawings is more complicated than drawings. Mock-ups, provisionals, final restorations, dentist lab communication, try-ins. So that is a good insight. Next topic, treatment execution. Of course, that's a big topic because the way APA does dentistry is very different than the way I always did, and the way the dentist that I worked with, the way my father did, right? He has a very pragmatic approach. So APA preps teeth to avoid ortho and showed how you can overcome limitations and get great results without ortho. And with smart preps, great smile design, great smart preps, great smile design skills, and great technicians. So yes, he showed very cool cases where you're like, you need to do 1.5 years of ortho, and he did 2 appointments and solved. Were the preps a little bit more aggressive? Yes. Is that extra aggressiveness, how that's going to play down the road, in 15, 20 years? We're not clear. Did he preserve as much enamel as possible, trying to avoid ortho? Yes, he did. Did the outcome look amazing? Yes. And the patient was extremely happy. So, many things to be considered. It's very beautiful to say what is ideal. 5 years of treatment, 3 surgeries, 2 years of ortho, blah, 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 orthodontic, airway, etc. Reality is different. And I like the fact that we were blending my more philosophical approach with his more pragmatic approach. Christian likes the combination of ortho before restorative. I do acknowledge the fact that many ortho cases go really bad, too many of them. True. So if you have a great orthodontist that understands restorative, I still believe you should explore that option. So you can become more minimally invasive and position bone, roots, gum, and teeth where they belong, ideally, before restorative. But Christian admits that this is much easier to say than to do. Being real. I love being real. I have no problem learning live on stage and really admitting that reality is different than philosophy, right?
Mm-hmm.
Guided tooth preparation. It's a big thing as well. DSD has a whole protocol to guide preps. And of course, APA does have guided prep. When it comes to prepping teeth, we both agree on something very, very important. APA and Christian agrees that preps need to be guided by the final design. If you don't know where you want to go, you will not get there, and your prep will not help you get there. So somehow, you need to know exactly what the final smile should be and exactly how the ideal prep for that smile should be and exactly how to transfer that project into the mouth. 3 things. You need to know what is the final outcome. You need to know what is the best prep for that final outcome. And you need to know how to transfer that from the project into the mouth. Whatever tool you want to use, DSD has a whole set of guides, completely digitally designed and planned to help dentists translate to that. APA does the direct mock-up, freehand himself, defines the project, and preps through, right? Uh, we believe on a project done in the lab, fine-tuned in the mouth. So we are very similar here. He does himself in the mouth. We do in the lab, and we improve in the mouth. He preps through the markup. We prep through the markup, but then we have extra guides to quality control what we did. APA believes that he has the eyes good enough to quality control with the eyes. It's done, is good. Let's go for the impression. APA uses his direct markup at the day of preparation to develop the ideal design and guide the preps by prepping through it, what I just mentioned. Christian believes that this is possible and can be good, but it is very hard to develop ideal designs in the mouth fast enough and under pressure. Details will be missed, in my opinion. Details will be missed, and a lot of experience, artistic, and hand skills are needed. It is possible, but not replicable, in my opinion. You can streamline the process by designing in the lab, fine-tuning in the mouth, instead of designing directly in the mouth. I have to tell you, even though I believe that doing everything in the mouth directly, you may miss points here and there. APA has a very consistent, what's it? His average is very good. He's very predictable with that, right? Every case I see with him, his direct markups are very good, even though I still believe that if you make an impression with that, bring back to the software, you will always find areas to improve, and we'll be able to make it even better in the software. Go back to the mouth and check it and validate it.
Right.
But it's all about efficiency, right? So what he does works for him. What we do works for us on this regards. CC believes that developing a digital 3D design, leveraging all the know-how from great labs, wasting less time chairside is smart. Always re-emphasizing that the dentist needs to evaluate, improve, and validate these designs in the mouth. So we're back to the same thing, right? The end is the same. You need to be in control in the mouth. How you get to the point to be able to evaluate, different tools. CC believes that APA has one of the best eyes for aesthetics and can develop these designs intraorally with accuracy and predictability, but systems should go beyond individuals. That's my point.
Right.
CC believes that labs can help a lot dentists to avoid mistakes when prepping and planning cases. APA believes that he needs to have total control, do it himself, and lab should only focus on translating his vision into reality. So you see the difference?
Right.
His speech to his lab, and it works for him. He's like, I have it all here. I control everything. I set the vision. I set the design. I set the plan. You guys need to focus on translating my plan into reality. Don't mess up. Don't invent. Don't create. And if you have suggestions, come to me. I will consider. But learn how to copy paste my vision. What I'm saying is that you can leverage much more than that. You can leverage the lab to actually build your vision, explore the vision, treatment plan the vision. So different approaches there. Ceramics, also a big point, because APA is a big advocate of old school handmade layered ceramics. And I'm a huge advocate of fully digital, monolithic, almost no hand involved restorations, right? So we are 180 degrees in different directions here, even though we both respect a lot each other. So I was surprised Appa showed a case with actually doing exactly what I say. He did a case where he did his handmade layered, and for the same patient, he did a whole digital monolithic restoration. And he tried both, and he said in front of everybody, I was impressed with the digital. It was hard to choose one of the two, but I did choose the layered because the layered handmade old school was a touch better. Now, this is a big statement showing how digital has evolved from his own words. And of course, I emphasize that. And we have to add to that discussion the fact that he does have 10, 20 of the best ceramists in the world, like the best. Right? Some of his ceramists today are, for me, top 10 in the world. Now,
Wow.
top 10. You have millions of ceramists in the world. You have thousands of very good ceramists in the world, but you only have maybe 100, 200 of the best in the world. He has probably 10 out of the top 100. So, of course, it's a unique situation that you need to bring into the multifactorial decision of what type of restoration you want to use. So, APA believes that layered ceramics is better than monolithic. CC believes that layered is maybe sometimes in some situations slightly better, yes, optically only, if you work with the very few best ceramists in the world. Christian believes that monolithic can look great if you have a lab that understands how to do it. And Christian believes that monolithic brings, beyond the optical aspect, many other more advantages than layered, and can successfully solve the huge majority of static cases with high quality. So people were able to see exactly how far you can go with layered. In the hands of few, still the gold standard. How amazing monolithic digital is today. So at the end of the day, the conclusion is master both and know how to choose. I believe that if you master monolithic, you're going to solve 70, 80, 90% of your cases with monolithic. And maybe there will still be some cases that you want to leverage layered old school handmade, maybe because of the patient, maybe because of the clinical situation of the case. So this is the final take-home message. Both agree that monolithic with reinforced ceramics can bring other challenges. So this was a common sense. Harder restorations is not necessarily better. If you use these more modern, harder materials, what the problem is that it's impossible to guarantee that occlusal equilibration is perfect. Never is possible to guarantee that. So many times you do have little interferences that you didn't identify. The problem is that when the restorative material is very hard and you do have these little interferences that are very common, where the system will break on the dental side, on the perio side. Restoration will not break, but the tooth and the gum will suffer. So the conclusion is that if there's something slightly off, where do you want the system to break? The restoration, actually, right? So having a material that is not the hardest is not necessarily a bad thing. You know, of course, you need some resistance, but you need to be able not only to have the restoration breaking before the periodontal breaks, but also the fact that you need to remove these restorations after 10, 15 years. And these hard restorations are a nightmare. So this was a common sense. So both agree that monolithic with reinforced ceramics can bring other challenges as how to remove them or harming teeth and gum when inevitable interferences are present. Christian emphasized that feldspathic can also be milled. That's a very common misconception for people. Oh, I love feldspathic is the most beautiful. I love handmade because feldspathic is most beautiful. You can do digital monolithic with feldspathic. So feldspathic is the name of the material. And nowadays, digital has evolved that you can have all materials being used on digital restorations. So the difference is that, is it hand layered or is it digitally monolithic? That's the discussion, right? That's the discussion. Christian believes and performs, this is important here, huh? This is a conclusion. Christian believes and performs hundreds of cases per month with a complete digital restorative workflow with an outsourced lab type of environment, and it works. Now, APA believes and performs hundreds of cases per month with an analog workflow in an in-house lab way of working, and it also works. So it's not about working or not working, right? It's about understanding the nuances, the pros and cons, and adapting to your style, to your situation, building your system, building your vision. We were sharing different approaches, and it's up to the audience to build their own conclusions and customize the ideas. Almost there. Appa believes that Christian relies too much on dentist lab digital communication. He made fun of me on stage. You spend too much time developing systems of communication, dentist lab, etc. Christian believes that Appa restorative workflow with analog impressions and hybrid dye models are very complex and time consuming. Not easy to find professionals to do analog work. Much easier to find professionals to do digital work, and much easier to train them into the digital environment. This is also something to consider. But Christian agrees that to be great, you need to be passionate and wake up every. No, that's another topic. Christian agrees that to be great, you need to master the analog procedures before you master the digital procedures. So you want to practice handmade wax ups, you want to practice handmade ceramics. That's the best way to give you the skills, visual, mental, and hand skills, to then jump into digital and master it. And the final conclusion here. APA mentioned that the guided digital workflow and communication systems presented by CC are for beginners. So I have to take a minute to comment on that, because he mentioned that, and at the course I didn't stop him because he was in the middle of his thinking process, and I allowed him to finish. Of course, I completely disagree in a respectful way. So he was like, "Oh, he said, I love what Christian just said, all the rules and the systems and the workflows and the digital communication. This is great for beginners. Let me show you what the masters do," right? I don't agree with that. I know I appreciate and I admire his workflows very, very much. And I did learn during these 2 days because I was always listening and I'm always learning. And I learned to appreciate his systems even more, and the fact that he has so much in his head. But I still strongly believe that my workflow is the future. Strongly believe that my workflow is the future for beginners and masters. But I also believe that he should never change his system because it's working and he's killing it, right? But I do believe that in 2, 3, 5, 10 years, the next Mike Appa will be completely digital. right? And will implement systems because it's just obviously so much less stressful. Because I know Mike, and I know that uh, in off, he is complaining about too much stress. He is complaining about the fact that too much depends on him and his hands. So when I catch him at the end of the day, he says those things, and I'm like, my systems are for that, you know, to allow us to do great quality with less stress. That's what I believe. It's not perfect now. It's evolving, and I do believe that probably what Mike was trying to say is that not that Christian systems are cool, but for beginners, but Christian systems are cool, are the future, are mandatory, and will become the new normal. But if you want to be the best, you need to go beyond the systems.
Mm-hmm.
And that's when you add that extra final 10 human touch extra percent that only great professionals can bring, that will take you beyond the systems.
Yeah. So well done, Christian. I have so many questions, and I know I can't have you picked a date for the next one? You don't have to say if you haven't. Don't just say I haven't.
No. We are trying. Really, was the event was so intense, physically and emotionally. The preparation. I've been lecturing for 20 years. You know, I've been like before big crowds and preparing for big moments. But this was beyond anything else I ever experienced because the responsibility was so big.
Yeah.
I felt more responsibility and more pressure on this course than ever before because it was new, and I was the one inviting APA, and I know that we had divergent ideas, and I knew that we would not have time to rehearse everything, and we were charging uh, a very high ticket price, really,
Right.
because to make this make sense for us, that you need a certain level of return, and I have no problem talking about that. That we need to charge. And we say, look, people need to value our know. We're going to give everything. For you to have an idea, Appa never gave a course showing all his systems.
Mm.
He is the most successful dentist in this planet with the most efficient systems to deliver quality with volume. And he never shared his systems before, and he did share everything this time. So we knew there was a huge value. And the last time that I stopped to build a program from scratch was 10 years ago when I built my DSD residency, right? And I decided that I was ready to do it again. And I did it for the last 12 months. And I was like, oh my God, I forgot about how hard it is to build something from scratch, right? Something from scratch that generates so much value that people will pay a high ticket and will leave the course saying it was worth it, because that's my main concern. Doing marketing and convincing people, that's the easy part.
Mm-hmm.
Making people pay is the easy part. The hard part is to have people, after they paid high ticket, saying it was worth it.
Right.
So I was pressuring myself for the last 12 months and for the last 6 months. And then the last month, my wife was like, what's going on with you? You give courses all the time. I said, no, but this is different. This is different. And day and night putting this together. So I'm saying this to say that we are still recovering.
Right.
We are still recovering. It's going to take a few weeks for us to let everything settle. And hopefully next month, we're going to come with the date
I love
for
it.
the next course.
I love it. Let's pull the third person in the room and give them a summary. So if I'm a listener, Christian, I've been listening to this in the car. Give me some final thoughts. Speak to me.
Final thoughts. I actually have wait a minute here.
I know when you have something written, you've spent a lot of time thinking about those words. So
But here. Take-home messages.
Yes.
Number one, I think that number one message from the course is patient success-driven mindset. It doesn't matter what my opinion is. It doesn't matter what Mike's opinion is. Choose focusing on the success of your patient. What means success for them? Number two, take-home message. Smile design is an art, not a science. It's more an art than a science. Of course, when you treatment plan, it's pure science and clinical, but everything starts from a smile design project, and smile design is subjective and artistic. So ask yourself how good you are with artistic skills, because otherwise, that's the only way to get better with this. Number three, build your professional vision, leadership, team building, and systems. It's impossible to deliver great smiles alone. You need an amazing team with you. Appa has an amazing team around him. We have an amazing team here at DSD, and we try to help doctors build great teams. But above all, build your vision. What do you really want to become a smile design practice? Because this is going to become a business itself. What Appa is, he's a smile design practice. People go there to transform their smiles. Period. Mm-hmm. That's why he's so successful. He's focused. He's niche. Number four, start with the end in mind. In smile design, you need to start from the vision, the prototype, the project. That's why we both spent so much time showing how we develop the prototype. How do we develop the project? You need to master all of them. You need to design smiles on an iPad over pictures. You need to have a smile simulation application. You need to be able to have a technician that can design in 3D, and you need to be able to visualize and identify the problems and comment and fix. You need to be able to do a digital wax up or analog wax up. You need to be able to do a direct mock-up or an indirect mock-up. You need to be able to start with the end in mind. You need to build the vision in your brain. You need to see the smile in your brain. You need to look at the smile and understand exactly what is right and what is wrong. Crazy people like me and Appa, we live looking at smiles, and we are constantly saying, this is good, this is not good, this can be improved, this cannot be improved. That's how we live.
Yeah.
So it all depends on how crazy you want to become, about it. It is crazy, and any person that is at the top of their profession, at the highest level of execution, any athlete, any artist, any entrepreneur, any scientist, they are all a little crazy.
For sure.
So, if you want to get there, you need to be a little crazy.
Yes.
Number five, branding happens chairside. We talked about that. The magic happens there. Marketing will not save you if you don't have a chairside system to impress. Team building, systems above individuals. So systems above individuals. Yes, smile design requires systems. If you want to transform people's life by transforming their smiles, this is very complex. You need systems. Dentist lab synergy, communication above individuals. Communication above individuals. Communication systems above individuals. Tooth preparation for success. Prep for success. Guided preparation. I said the three things. Visualize the design. Visualize the prep for the design. Find a way to translate the prep in the mouth. Don't prep more, neither less than necessary. Prep exactly what you need for that design. Prep by design. Number 9, you never have a second chance to make a first impression. When it comes to smile design, rehearse what it means to create a first impression as a smile designer. You can speak as a clinician, you can speak as a treatment planner, you can speak as a general practitioner, you can speak as an orthodontist. You need to rehearse how to speak as a smile designer. It's different.
Right.
And patients love it.
Love it.
And the final message, number 10, was you have to enjoy the ride. As I said, you need to be a little bit crazy to get at the highest level, but you cannot waste a life suffering to get there. You need to enjoy the ride. I can tell you, I work hard. Appa is one of the guys that I know works hardest. Is like crazy. The amount of hours and working when you're sleeping, thinking, waking up Saturdays and Sundays and just thinking and developing things and writing things down. And it is hard. It is a lot of work to stand out, to be different, to be above average. It's very hard. But I have a lot of fun. And I can tell you, Mike has a lot of fun doing that. Regardless of whatever is happening, becoming the best he can on what he does, he loves it. And so do I.
Love it. So well said, Christian. Now, if somebody's listening and they don't know what DSD is, tell me where to go. What do I do? Where do I start if I want to learn more?
DigitalSmileDesign.com. Very simple. The whole journey is there. And as our name of the company, our company says digital. Yes, digital, but smile design. So we are all about digital, smile, and design.
Love it. Love it. So if you're listening to the podcast, you're not taking notes, don't worry. We're taking notes for you. You can flip up to the notes in Stitcher, iTunes, Spotify, whatever you're listening to. You're going to see links to what Christian just mentioned. I'm going to encourage you. Follow him. Watch this process. You'll be inspired. Christian, thank you so much. That was phenomenal. Really appreciate you, my
Pleasure.
friend. Yeah.
See ya.
Awesome. Well, stick around while we say goodbye to everybody else, but thank you guys for listening to the Best Practices Show. I hope you enjoyed that. One of the coolest things is to listen to the greatest minds and decide your own path. And if you keep showing up, we'll keep bringing it. We're going to have Christian back again and again and again, share some great thoughts to improve your journey on this road in dentistry. So until we see you guys next time or you hear from us next time, keep watching or keep listening to the Best Practices Show. You guys enjoy your day.